We were talking about all the health apps on your telephone
Right.
because
Okay.
our guests today are Richard Toon. He's the health, I like to call him the head of the health department. That's what I call you. But your little title here says health officer, Jackson County Health Department. And then Elizabeth Cross is the manager of community health for Allegiance Health. A lot of health going on
Wow.
here.
Yeah, thank you. We're pleased to be here.
Yeah.
Yes, we are.
So, you guys gotta make sure you're talking to the mic so they can hear you. But we're gonna talk about what's called HIO. So you guys start off by telling me, what's an HIO?
Well, it's simply an abbreviation for the Health Improvement Organization that we work in here in Jackson County. It's a collaborative of community stakeholders, and we're committed to improving the health status of the community. We use an integrated health improvement infrastructure to do that, to address the priority health issues in Jackson.
So what are some of our priority healths, do you know?
You mean our priority health issues?
Yeah, your priority health issues, sorry.
Well-
What are some of our issues? Or
Well-
maybe there's too many to go into.
Well, there's always a top 10 list, if you will, and we could certainly talk about those.
Sure.
But obviously, chronic diseases, including heart disease, stroke, asthma, obesity, those are all in our top 10. But we also look at other issues from an environmental perspective, like how many children are lead exposed, what our teen pregnancy prevention rates are, our rates are. And those are some of the key things that we're working on. We also work a lot on trying to increase physical activity among everybody in the community.
Oh, and that's what we were just talking about as we were rolling in.
Yes, we were.
I have this Fitbit, and I got green, because I looked at another one, but they only came in black, so. You can get these apps that come in your phone. Greg will have to get you hooked up here.
Sure.
Count your steps, 10,000 steps. So, and then map my ride. I use that one all the time. Anyhow, is there one thing that like if you were going to focus on one issue in the city, health issue wise, what would it be? If you had to pick one.
Yeah, well, probably within the city of Jackson, it's it's difficult for me to pick one, so I'm going to pick three.
Oh gosh, there you go.
Three.
Yeah. Well, you're the head.
Since I'm the
so-
health officer, I'm going to pick three.
Okay,
Yeah.
3.
Well, we continue to have a lot of higher risk within the city of Jackson for teen pregnancy.
Okay.
So we're continuing to focus on that. We keep funding that every year. But also, there's a lot of environmental issues associated with asthma. We'd like to do more with a community-based intervention to help prevent asthma in children and prevent hospitalizations and ED visits.
Okay.
And we'd like to do more of a coordinated effort with testing children for lead, because we have a lot of old housing stock.
Yeah, well, that's, I think 80% of our housing stock is old in the city. So what are you doing about it?
Well, what we're currently doing with teen pregnancy is we do have a very well-organized and functioning teen pregnancy prevention initiative. And that has been in place for a number of years, and we are seeing dramatic reduction in the number of teen pregnancies occurring in Jackson County overall, and as well as the city. We've probably dropped 40% in about 10 years.
Wow.
So we're doing very well. Now, the state overall has also dropped about that much, so we're just kind of lockstep with the state. We'd like to get below the state rate if at all possible.
Is that an education effort? I mean, why are these teens getting pregnant? I mean,
Well-
I know.
You know, okay. Well, a lot of it does have to do with education and also building self-reliance and the image of teenagers.
Okay.
We do a lot of that work with our teen outreach program and through the initiative as well. So it's really helping teens understand that there are other choices that they can make, because this one results in lots of difficulties.
Yeah. In fact, I just had a conversation with a friend of mine, and her daughter is 17, and she was in the hospital because a baby was just born. So, and her sister had, for years ago, had gone, I don't know, 5 or 6 years ago, had gone through the same thing. So you would think that the sister would have learned the difficulties that her older sister had, but clearly.
Well, it's nothing new.
Yeah, well, apparently. Well, and they say that by 2025, only 25% of our households are going to have children. Are those all going to be teenagers having children?
We would certainly hope not.
Yeah.
It's from an economic return on investment perspective, we save about $5,000 each time we prevent a teen pregnancy.
Wow.
And it costs us considerably less than that to prevent one. So
Okay.
prevention pays.
Yeah.
So Richard, who are we blaming for that problem?
Well, we're not blaming anybody for the problem. We're just saying that there are more education needs to take place of both parents and children, working with the high schools, working with the school districts, and working with the teens themselves. We want them to focus on other things than necessarily sexual activity at their age.
There you have it. What about the other issues? Asthma.
Well, asthma, we probably spend roughly about $2.5 million a year in asthma healthcare. And that is primarily through, well, we used to have an urgent care center here run by Legion's, but that's since been closed. But between the urgent care center, the hospital on an inpatient side, and for outpatient visits that could have been avoided for an asthma-related emergency, we spent about $2.5 million. And what we want to do is to do more work at a community level. We would characterize it as a community-based intervention for asthma, which means that we also go out to the home and the home environment of the family where the child has been diagnosed with asthma, and we address the triggers that create the emergencies.
Now, forgive my ignorance because I don't have anyone in my family with asthma. Are you born with asthma, or is this like allergies something that you can get as you get to a certain age, or?
Well, there is some evidence that it has a tendency to be genetic and pass along through families that way. I don't know that there's been a lot of research done to look at specific genes that might be associated with being more likely to be asthmatic. But what we do know is that there are a lot of environmental triggers that we can do a better job of controlling for those families and children.
We used to, the franchise we used to be a part of had a program that where you'd go into the elementary, we as realtors would go into the elementary school and teach this little program called A is for Asthma, so that the kids in the elementary school could understand what another child was going through that had the asthma. So it's kind of fun.
Right.
And we also have one for lead, so that leads us to the next one.
Well, we do test, well, we're required basically, whether it's the health department that's doing the testing or healthcare providers are doing the testing, but all children that are enrolled in Medicaid health plans are required to be tested at least once by age 2 years, excuse me. So a lot of that goes on, and we do have a program.
For lead, they're
for
being
lead.
tested,
Being
okay.
tested for lead exposure because they're already high risk if they're enrolled in Medicaid.
Okay.
Is that mostly lead paint?
Yes, the source is mostly lead-based paint. I mean, that's the vast majority of it. And we test.
Not lead pipes.
Not lead
'Cause
pipes.
these old homes have a lot of lead pipes.
That's a small exposure.
Okay.
Most of it's really lead-based paint, both potentially indoors and outdoors.
Okay.
So we do a lot of testing at the health department, and we follow up with a lead assessment of the home environment for every child that is diagnosed with a lead test result that's 10 micrograms per deciliter or higher. And that's probably going to change and drop to 5 here relatively soon, because there basically is no safe level of lead exposure in children.
And so as a realtor, I have to do this disclosure for lead-based paint for homes that are built 1978 or older. And so I go through this spiel, and I always tell that, and it's for 6 years or younger, children 6 years or younger, so don't let them chew on the windowsills. Or if you're pregnant, don't be around the house when they're sanding the walls, because a lot of homes have already covered up the lead paint with latex paint now. However, it's still down deep onto the windowsills. So if you come into one of my rentals, let's say, and I have a 6-year or younger tenant, well, the parent would be the tenant, and we've totally renovated it, but there's still lead, a couple layers down in paint. What would happen?
Well, if there's still lead a couple layers down in paint, the area to be most concerned about is whether or not you're going to abrade away the latex paint that might now be on the windows. Particularly old wooden windows, when they're moved up and down, they create dust.
Okay.
And eventually they can get back down to the layer of the level where the lead paint is.
Okay.
So it's still a concern.
So if you test a tenant, let's say, because more than likely they're probably going to be a tenant, I'm going to guess. So you find out that the kid has lead paint, but they just moved into, or they've only been into my unit for 3 or 4 or 5 months, not a very long period of time. Is it my unit that's gonna get tested, or is it the unit they came out of? Because more than likely, it isn't my unit that they got the lead from.
Well, it's going to be your unit that gets tested because that's where they're residing. But if your unit is not the source of exposure, and it may have been 3-4 months ago,
Right.
then we're going to be able to figure that out.
Oh, okay.
Yeah.
Because, that's a little nerve-wracking. I mean, mitigating for lead is not like mitigating for radon.
No, it's a pretty labor-intensive process with a lot of controls that have to be in place to protect the environment and people.
Well, and the labor intention makes it very expensive.
Yes.
Now, are there programs that help landlords or property owners, let's say?
Yes, there are some programs available through the Michigan State Housing Development Authority in the form of at least partial payments for particularly landlords who may have a property. It's a kind of an application process that the landlord has to go through, but there are some resources available. It's not going to pay for the full cost, but at least you might hope to get 25 or 50% of the cost covered.
Okay. And I know the city just did a home on Ganson that a family had exposure to lead, I assume the children. And so the city had gone in and done some renovations, including lead abatement, with CBDG money. I always get those initials,
Yeah.
despite the number of years I've been exposed to it.
But we are.
So you have a survey going on.
Yeah, we
You
do
wanna
have a
talk about
survey.
that?
Yep, I'm going to let Elizabeth talk about the survey, and she
Okay.
has all the details.
All right.
So Richard talked a little bit about the Health Improvement Organization and what we do, and he was talking about some of the health issues that we have here in Jackson, and the Health Improvement Organization stakeholders. We actually kind of divided into a few action teams to help work on developing programs and initiatives that support working to address physical activity problems, nutrition, smoke-free living, behavioral health, and things of that nature. So in order for us to inform our work on, how we can create programs that actually address the need of people in the community, we do a survey once every 3 years. So this is the third time that we're doing the survey. And we contracted with a consulting firm called Research and Marketing Strategies.
Okay.
And they are the people who are calling homes and talking to people about chronic disease diagnoses, physical activity habits, eating habits, and then just general demographic information as well. So the survey is running about 30 minutes. And there are about 180 questions.
Wow.
Which sounds like
I'm
a
gonna
lot.
be really tired by the time I get off the phone with them.
Yes, we've so far, I think that we started with the survey out in the community about 3 weeks ago, and we get, weekly updates from the firm that's doing the survey for us, and they've had really positive feedback. They have people, if they might not be able to finish in one session, they're able to schedule another time to finish.
Okay.
And we actually have quite a few of those people that actually are, keeping their scheduled appointments and finishing the survey. So it's really important for our work, and not just for the HIO, but for other community coalitions and collaborations that have strategic action plans working towards addressing some community needs. So, like the county commissioners, United Way, and Allegiance Health Board too. This really helps to inform everybody in the community.
So do you know what some of the questions are?
An example of one of the questions would be for physical activity might be how many days a week do you on average perform aerobic activities like running or swimming or walking.
Okay.
Another one for nutrition would be how many times a week would you say that you have fruits and vegetables? So it's really, and we've been, we take a lot of our questions from nationwide surveys. So we're really trying to keep track of trends, throughout years, so we can see where we're at, over
okay.
long term.
So this is the third one you've done, so you'll have 2 others to compare to.
Right.
which will be better than, it'll be interesting, I think.
Right, the
And
more
you're gonna
data we
share that with
have.
whomever is interested in getting it. So if the city wanted to implement, we're doing our master plan session, our process now. And so maybe we could implement some of that stuff into our master plan.
Right, and in, some of our meetings, we've had discussions. Some of the health department staff have talked about how, they're going to be part of the town halls. I believe you had one for the master plan yesterday, or was there one this week?
Sunday.
Sunday
Okay,
was the
Sunday.
wrap, well, we have 2 wrap-ups, one was Sunday and the other one is tonight,
Okay.
6:30 to 8:30.
So we have, representatives from our health improvement organization that are, in all of these different pockets that are kind of helping to spread the word and
Right.
increase that collaboration among, everybody in the community.
Well, I know there's someone on our Walkables Coalition committee from your organization. Actually, she works for you, I think.
Is it Rhonda?
Oh, God, don't ask me names right now.
Maybe Julie.
Julie, it's Julie.
Julie Weisbrot.
And she's got great input, I'll say, great ideas, so,
Yes. We also wanted to make sure that people knew the number, because there is one phone number that the surveyors are calling from.
Oh, okay.
They
So you can call in and be surveyed?
No, the way that the survey is done is it's randomized, so that we can get the best representation across the county.
Okay.
So you can't call in, but the number, when it pops up, unfortunately, it does say it's an unknown number.
Oh,
But
That's trouble.
Yes, it is trouble. But we found that, through being out in the media, we had an article done in the Citizen Patriot that was put out on the 22nd of May.
okay.
We have press releases and things out there, and actually, a lot of people are saying that they're getting information about it, so they're more likely to. But the number is 517-386-1357. So I'm sure people probably aren't out there writing it down, but at least
the
it might ring a
386
bell.
number. If you see
Yep.
a 386 number, pick it up,
Yep.
Definitely.
because they need the help. So that's the only way you're doing the survey is by phone. I'm
Yes.
not gonna go into my doctor's office and be handed this survey.
Yes, we're doing a different way this year, actually. We're doing both landlines and cell phones because,
I didn't get the cell phone numbers.
the cell phone numbers, there's actually a pool that is public, and
Oh.
you can pull them from that
Put your
as
numbers
well.
on there, Craig.
I hope not. I just can't imagine people are on the phone for a half hour. I
And
mean,
it is quite a commitment.
especially answering an unknown call.
Well, they tell you, I assume. Will you take the survey? It will take 30
Well, I
minutes.
understand that. but
Yeah, okay.
As soon as they say,
30 minutes.
how many questions was it?
180.
Oh my goodness.
Did they tell you that it's 180?
Yes, in the beginning, we state.
I just can't imagine people,
Well, it's probably like our master
It's
plan
gotta be
process.
difficult.
Well, our master plan process, we found the majority of people who showed up were my age or older. And that's because we
Yeah.
care,
well, that's what I would
And not
think
that the
about
younger
this
people don't
survey.
care, but they may not have that extra time where the older
Wouldn't
people
this
do.
lean to an older person who might sit down and do that as opposed to a younger person?
You
Do
know,
you tell them you're gonna ask them 180 questions?
Yes, we actually, so every week, we keep track of how many people we have and what ages and all of those things. And I mean, right now, I think we have about 300 and something surveys that we've done so far in the last 3 weeks.
Okay.
And we're in the low single digits of people that only completed it partially. So people are actually going through, but it's a good spread
Age
of
demographics?
ages.
Wow.
Yeah, it really is.
That's a challenge.
All right. Well, I appreciate you coming in.
Yeah, thank you for having us.
And we're going to wrap it up now. I just have a couple announcements. First of all, I met the cute, how Bill had a couple young people listening now to your radio show. You have 2 more.
Oh,
You
good.
have Julia Allen, who's 3, and or 4. She might be 4, and Jacob Allen, who I think just had a birthday and turned 6.
They're not related, are they?
They are
Oh.
brother and sister, adorable.
Great. Thank you.
And
Thanks for listening.
they're listening. And then I have a new listing at 7453 Ben Road. It is a great farmhouse, 99.9. Sits on over 2 acres, 3 bedrooms, 2 full baths, over 1,100 square feet in new kitchen, new bathrooms, hardwood floors. Much cuter on the inside than it is on the outside. Call me, 780-3800.